The RENASYS Gauze Dressing Kit with soft port is intended to be used in conjunction with Smith & Nephew RENASYS Negative Pressure Wound Therapy (NPWT) devices. The RENASYS NPWT system is indicated for patients who would benefit from a suction device, negative pressure wound therapy, as it may promote wound healing via removal of fluids, including irrigation and body fluids, wound exudates, and infectious materials. Before using, refer to the Instructions for Use (IFU) for indications, contraindications, warnings and precautions. Debride any devitalized or necrotic tissue. Cleanse the wound bed and pat dry. If desired, protect the peri-wound skin from exposure to moisture and adhesive through the use of a skin sealant. If desired, a non-adherent dressing may be applied to the wound. Trim a layer of non-adherent dressing and lay across the wound bed. Moisten the antimicrobial gauze with saline. Apply a layer of saline moistened gauze to wound bed. Unfold remaining saline moistened gauze and loosely fill the entire cavity. Avoid overpacking the wound. Precaution: if multiple pieces of gauze are needed to fill the wound cavity, count and record how many pieces are present to ensure all are removed at a dressing change and to minimize the risk of retention and possible infection. While holding the transparent film, expose one side of the adhesive backing by removing a single panel and apply over the wound. Cover the gauze with transparent film, removing adhesive panels to seal. Then the top stabilization panel. Recommendation: the film should extend at least 5 cm (2 inches) beyond the wound margin and be securely anchored to the peri-wound to maintain a good seal. Overlap the edges of the transparent film by a minimum of 7.5 cm (3 inches) when using multiple pieces of transparent film. Cut a circular opening no less than 2 cm or 1 inch in diameter in the center of the film over the antimicrobial gauze. Remove any loose transparent film and dispose of away from the wound. Remove the adhesive panel from the RENASYS soft port dressing and align the port opening over the cut hole in the transparent film. Use gentle pressure to anchor the soft port to the transparent film. Smooth the dressing down while removing the soft port's top stabilization frame. Secure the RENASYS soft port to the patient according to your local protocol. Ensure the aeration disc, located near the quick click connector, is not covered or otherwise occluded by the method used to secure the soft port. Connect the RENASYS soft port tubing to the canister tubing by pushing the quick click connectors together. An audible click indicates the connection is secure. If using a single soft port connector, ensure the Y connector mode is in the off position on the pump. To begin delivering therapy, set the pump to the desired pressure and press the Start Therapy button. Finished gauze dressings should be leak-free and firm to the touch. Routine inspection of the negative pressure wound therapy device and dressing should include visual inspection and palpation of the dressing. The RENASYS touch device and system tubing should be positioned no more than 19 inches or 50 centimeters higher than the wound to ensure optimization of therapy and prevent therapy interruption. Gauze dressings should be changed 48 hours after initial application of therapy. If no leak is present and the patient is comfortable, dressing changes should occur 2 to 3 times per week. Precaution: the use of negative pressure presents a risk of tissue ingrowth into the foam or gauze. Tissue ingrowth may be reduced by lowering therapy pressure, using a wound contact layer, or by increasing the frequency of dressing changes. For detailed product information, including indications for use, contraindications, effects, precautions and warnings, please consult the product's operating manuals prior to use. If you have any questions, please contact our customer services team on 08000 157 573 or email customer.services.uki@smith-nephew.com.